My role as a patient advocate is to act as a liaison on the behalf of patients anytime there is a concern. Patients coming into the healthcare facility, it's a pretty different environment to be in when you're not feeling well. And so anytime we feel that there's a disconnect, I'm bridging that gap for both our team members and our patients to reach some type of resolution and clarification on what is good care. So the benefit of having a patient advocate in the hospital is clinically, when a patient comes into the hospital, they're just looking and seeking for help. And sometimes in the clinical world, that's very difficult. You see different doctors, different nurses, you have different tests, and it all can be pretty much almost a cloudy world for them. And so the same way I would advocate for my mom and dad, it's a benefit of having a patient advocate in the hospital on behalf of the patient to speak up for them and about things that they don't understand. So when they're feeling alone or they're just not quite sure that everything's going well, with unfamiliar faces, they have someone to be able to speak for them. I remember a time a patient was frustrated because she had been discharged from our inpatient side of the facility. She'd gotten home, and as she was with us, there was a medication change to her home medication regimen. And so typically we refer any prescriptions that need to be refilled or filled in general to the primary care provider. At this time, she was trying to contact our hospitalist and kept getting redirected to her primary care physician because they just quite couldn't understand what the need was. And so in talking with her, I was able to resolve that by explaining to them that this was a prescription that had to be written out. And so in talking with our hospitalist, we were able to get that prescription that she needed. And I personally drove that to her home pharmacy. And so the patient was very satisfied. It was a team effort. And as a result, we were able to establish a new process to ensure that all patients that are discharged do leave with their home medication.